Hey everybody, Dr. Nuveen here. I just wanted to make a short video about some of the things we do when we don't have patients. Today we don't have patients, so follow me. Okay, so what I'm going to show you, if you come over here, is, not my computer, how I make retainer wires for the back that we glue in behind your bottom teeth when you get the braces off. And if you didn't know, I actually make each one of these myself. This one's actually pretty easy because the teeth are a very normal shape and size, so hopefully this won't take too long. Bring it in. Okay, so I cut this piece of wire, I shaped it into a sort of U shape there to match the general shape of the teeth, but of course if I hold it up against the teeth it doesn't fit, so I have to change the shape to adapt it to this person's teeth so that we can have a nice fitting wire. And of course we glue these wires onto only 2 teeth in the mouth, and that allows you to floss around the wire super easy. However, it also makes it a little fragile, so if you bite on something too hard with this wire or with your lower front teeth, there's a possibility you're going to break the wire off the teeth. And I'm sorry if you can't see this very well, but I'm trying to go quickly so this video doesn't get too long and I lose you. But I need to make a bend here, special bend. We call that a bayonet bend, like those swords they stick into the end of their guns, soldiers do. And then I start working my way across the teeth from the left side over, making sure that the wire fits really well against all the teeth. It's supposed to touch the back of each tooth across the bottom there, so that you don't have a bunch of food getting stuck in there all the time, which is really annoying. And then what happens is, if you get food stuck, you take a fork or a toothpick or something like that and you jam it in there, and guess what? You pop the wire out. So that usually indicates the wire's not fitting as well as it should be. That looks pretty good. Make a little adjustment right here. So for this particular patient whose teeth are beautifully straight, if I say so myself, I did a great job, that I actually have to make a bunch of adjustments on the wire because their teeth are of various thicknesses and the wire doesn't sit quite right unless I make these customized adjustments for this particular patient. That's great. I don't know if you can see that, but there's no room between the wire and the teeth. And then same thing over here. The wire fits really well. I think I can make that fit even better. Tweak that a little bit. Good. Good. This, stretch it out a little bit. Do not try this at home. This is extremely dangerous. I'm joking. Funny guy. And I think that's good. So if you'll notice, the wire, if it's made properly, sits right about at the same point as the teeth contact their neighbor. So right about a third of the way down the tooth from the top to the bottom, that's where the wire is supposed to sit. And if I can just tweak this here. And then what we do, check it from this side, that looks great. Okay, now the tricky part. I have to get this Okay, where was I? This is the best wire ever and the worst video ever. Okay, so I was going to wax this wire in place, but this thing isn't working. So let's see. Oh yeah. Now I got this wire in the right spot. Bingo. And heat this little spatula up. Grab some of this fun wax here. Make sure this doesn't move. Get this wire waxed onto one of the teeth. Get the other side waxed in place. Like that. That's about it. There's a retainer wire ready to go. And then we make a little transfer tray, and when the patient comes in to get the braces off, we glue the wire onto those two teeth. That's it. See you in the next video.